A little bit about myself. So like I said, I'm super excited to be presenting today. Foot and ankle is a special interest of mine. Like I said, I work at the physical therapy location on Broadway in Wilmot. I graduated from the University of Florida with my bachelor's, and I went to the University of Central Florida for my doctorate in physical therapy. So I'm a true Floridian. I have a special interest in running related injuries as well. So I've been running for the last, say, 20 years or so. I've done distances between a 5K to an ultra marathon. So if you're a runner, I can totally relate with you guys on this one. Yeah, and you might be seeing me on the weekends. I'm usually either trail running or running the roads. So I can talk with y'all about that.
I'm trying to get into that thing.
Okay, so going into the foot and ankle.
On the internet.
Nicole, before going forward, if you click participants, you can mute everyone.
Well, because I don't get any sound.
Hold on, unmuted.
So just click participant, and then you can click mute all.
But should we allow them to unmute themselves? Okay, there we go.
All right, so now diving into foot and ankle anatomy. So what's really cool, I've got my little foot model here for you guys as well. The cool thing with the foot and ankle is you think about it, it's such a small area, and yet you have to support so much of your body onto the small region here. There's 28 bones total in the foot and the ankle. And there are 3 parts of the foot and ankle. You have your hind foot and rear foot. So that's this area right back here, your heel, for instance. You have your midfoot right in this region here. And then lastly, you've got your forefoot. So that's the ball of your foot. What's really cool with this whole thing is you have to have all of these joints in those 3 regions working very well together to help yourself with landing and pushing off and supporting yourself. So if something's wrong in one region, that can throw everything off. As far as ligaments, I put one on here. That's the ATFL, and that is right in this region right here. That's a common area for ankle sprains. I see that a lot with athletes or just people who, you were walking, you had a fall, or you twisted your foot and you just had some pain on that outer part of your foot there. So that is something I commonly see in the clinic. We do a lot of variety of exercises to help out with that, a lot of hands-on treatment to help out with that too. Lastly on here, I have different muscles. These are just 3 of them to name off a few. I've got the Gastroc and the Soleus. So if you're looking at your calf right now, that big tissue on the back of your leg, that is your Gastroc and your Soleus. The Gastroc is a big muscle on the outer part here. Soleus is a smaller muscle on the inside here. And they're in charge of pushing your foot downwards. Posterior Tibialis, I put on here because that's another commonly affected muscle. You get something called Posterior Tibialis Tendonitis. That is a muscle right on the inside here of the foot and ankle. It's in charge of pushing your foot downwards and inwards. So you have to have a lot of control there. So sometimes I'll get runners who have just some irritation in that muscle. And a lot of it's just the way they're running. They're not engaging that muscle enough. So there's certain exercises I do to really get that stronger, get that moving better. All right. Okay, next slide. So one thing I think is pretty cool about the foot and the ankle is there are 4 layers on the bottom of your foot. So within the foot, you have all these tiny muscles, and they're so important when it comes to controlling your foot and ankle, whether it's standing for a long time or just propulsion. So what I mean by that is you're putting your foot on the ground and you're pushing upwards, whether you're walking or running. So those muscles have to be engaged. There's different exercises you can do to help address that. I'm going to show you guys one of them too. So you guys I want you to try to join along in with me on this one. It is a little bit challenging. So if you can't get it off today, keep practicing it at home. This is just one exercise I have some of my patients do. So I'm going to take my shoe off right now and show it to you guys. So if you guys can try to go along with me on this one. Okay. That's right. You go downwards. Okay, so I have my foot here planted on the ground, and I call this toe yoga, by the way. What you're doing is keeping everything on the ground. Try to lift your big toe upwards. Okay, so you're just lifting the toe upwards. You're keeping the outer part of your toes on the ground. You're keeping your heel on the ground, and then you do that with the outer toes as well. You're gonna lift your outer toes upwards and back down, keeping your big toe planted on the ground there. I'm sure some of the people watching this are not able to do that. So if you're not, that's a good exercise to practice on. And maybe that's something that's, if you're having an injury, maybe that's part of the issue is just getting those muscles stronger. All right. Can we get back onto the slide then? So like I said, that's just one of several exercises we do. Okay, next, wanted to go a little bit into this. It's called pronation and supination. So when you are walking or running, those are two natural movements you experience. So when you land, you're going to go into more supinated position. So you're going to be more outwards. As you get your foot all the way on the ground and you're getting your body over your foot, you tend to do what's called pronating. You roll your ankle inwards. And then when you're pushing your foot offwards, you're going to go back into that supination. So those are natural movements you need to help get your foot off the ground. Sometimes can be an issue though. Sometimes we tend to over supinate or over pronate. That may be because certain muscles are just not engaged. It may be that the joints are just stiff and we just need to work on loosening those up. That's something we can work on in here. Or, if you need something to just get yourself through walking, running through the day, certain types of footwear can help out with that. And James is going to be talking with you guys about that in a few minutes. I got on here different types of conditions. So these are just a couple things, not everything, just a few things that we work on in the clinic, different conditions. So let's jump into that. One of the first ones I like is plantar fasciitis. I see a lot of this one. What it is you have this tissue here on the bottom of your foot. It goes from your heel bone all the way to the ball of your foot, and that is called your plantar fascia. Usually I hear people say that they get it first thing in the morning when they wake up after sleeping, that foot's in that position, things are stiff, so it's very irritable in the morning. It can also be if you're working or standing on your foot for a long period of time, you get some irritation on that bottom of your foot. Or it's just, or just with walking in general. What that plantar fascia does is it helps when you're landing on the floor and you're pushing yourself upwards to get your foot off the ground. That puts a stretch on this area. So if this area is kind of tight, for instance, or certain other things aren't working that well, this area can be what's affected there. I put some risk factors here on my slide. So high and low arches. What that is on the center, on the inside of your foot here. If you're looking at your foot right now, you can have a high or low arch. Everybody's different. Some people are a little bit higher than others. Some are lower, so just like extremely high or extremely low. Limited ankle dorsiflexion. All that is just mobility in the ankle joint here. So if this is not moving well enough, takes more on the plantar fascia. Limited great toe extension. So basically your big toe. So if this is not moving enough, puts more stress on that plantar fascia. Decreased foot and ankle strength. So that's the muscles at the bottom of your foot, those foot intrinsics, toe yoga. High ground reaction forces when running. Basically what I mean by that is if you're running and you're constantly pounding the ground, you're going to take a lot of impact on that region there, and it does get irritable. And lastly, obesity, because you're putting more weight on your foot. Okay, and I just put on here just some things we work on in the clinic to treat this. Foot strengthening, like I said, toe yoga is a good exercise. Arch lifts, that's another exercise I do in the clinic for very high or low arch heights. Manual therapy, that's something I do hands-on. So sometimes I will be working on loosening those ankle joints so the joints are moving better. Soft tissue mobilization, sometimes I'll do some hands-on work to just loosen that plantar fascia, sometimes to work on the calf area there, because that can be, if that's tight, it puts a lot on this area here. Showing you guys some stretches. There's so many different stretches to do before or after an activity. You have stretches where you're standing in place, stretches where you're actually moving and stretching it. There's so many, so if that's something you're curious on, just let us know. And then lastly, footwear. So specific things for footwear for plantar fasciitis is a well-cushioned shoe, very supportive. So supporting that arch. So there are different types of shoes that help support the arch, whether you have a high or a low one. Shoes with a rocker bottom. So that helps, that just assists with pushing your foot upwards there if you need that extra boost. And then rotating shoes. Because a lot of times I'll get people who come in and they have shoes, but they've had them for say over a year. they wear them pretty frequently. All that cushion has worn down, all that support's worn down. And at that point, it's, if you're on your feet for a while, it's okay, we need to find something, another shoe for you then. And like I said, James is going to be going into more shoe stuff with you guys as well. All right. Hold on one second, guys. Okay. Okay, next condition, Morton's Aroma. So that is, I put it right here on this picture here. This is between the third and the fourth toe. So usually people get this burning sensation in that area. It's usually when you push off with walking or running because you're putting pressure in that region. It's like a burning sensation. A few different things you can do with that is, again, foot intrinsic strengthening the bottom of those feet there. Controlling overpronation, that's been associated with Morton's Aroma. So if you're overpronating when you're walking or running. Some things for shoes and inserts. You want wider shoes because if you have a narrow shoe, that's putting a lot of pressure on that region there where it's irritable. And then lastly, a metatarsal bar or pad, because what that does, it's a type of insert. It's right here on the forefoot area, and it just helps lift your toes upwards. So that way, when you push off, you get a little extra support in that area. It's not putting too much on that sensitive spot there. All right, and then next one, neuropathy. So I see this a lot with patients who have diabetes, for instance. What it is a couple different things. You have less sensation in your feet. You might experience some pain in your feet, and weakness of muscles within the foot and the ankle. So I also see, because of a lack of sensation in that area, you can't feel things as well. That can put you at an increased risk for foot ulcers. So just some sores on your foot in different areas. I usually educate people on foot care to help address this, so that way you're not getting foot ulcers, you're not putting too much pressure on certain parts of your shoe. I recommend foot checks, so just taking a look at your shoe or looking at your foot about one time a day at least. I put on here just some ideas of some products you would want to use to help clean that. Some shoes and socks, you want to make sure they're breathable. And then lastly, if you do buy a new pair of shoes, you want to make sure you're breaking into them gradually. And then last condition I'm going to be talking about today is Achilles tendonitis. So I have on this picture your Achilles tendon. It is that tendon right on the back of your heel there. It's like kind of like a long thick cord. A lot of different things can be affecting this. So, okay, if you are a runner, for instance, I do see runners with this. So one thing I see is if you're going on incline, you're pushing way too hard going up or down, you can put irritation on that area because, like I said, that gastroc soleus, that's the muscle that attaches to that tendon, and it is involved in pushing downward. So you're using that tendon a lot with this motion here. Also, too, things like not having enough ankle motion, because then you're putting way more stress on that area. So certain things may be too tight, certain things may not be as strong and not working enough. That would be something we'd have to really address in the clinic, though. And then another big thing I've seen in the past is certain shoe issues. I've seen people who want to run and they were wearing these big bulky shoes, and then they say, I've heard minimalist shoes are pretty good. I just jumped right into a minimalist shoe. You can do that, but the issue is with the minimalist shoe, going to a minimalist shoe too quickly, it's kind of like telling somebody to lift, say, 100 pounds and going to, okay, we're going to do 200 now and the next day. It's just, you have to wear yourself into that. Sometimes people jump into it too quick and then they get irritation on that region. It is one of the most common overuse injuries with running, and people tend to get pain with this with standing and walking as well. All right, and I want to show you guys another exercise for this one. Usually for that Achilles tendon, to help prevent or address the symptoms, you want to load it. So you want to get it stronger, but within what's tolerable for you. So I'm going to show you a cool exercise you can do for this one. It is called a seated calf raise. I'm going to have you point downwards for me, Paula. So, hang on one second. Go down. All right. Let's see my shoes here. Okay, so what you're gonna do, and if you can, join on with me with this. All you're doing is you're gonna be sitting down, keep your 4 feet on the ground there, and you're just gonna lift your heels upwards. try to keep your big toe on the ground. You don't want to lift your toe upwards. And you're gonna come back down slowly. Just do a few of those. Don't want to go too fast, not too slow. Again, make sure your toe is on the ground. If that's easy, you can do it standing now too. And then come back down. So when you do this, you want to make sure your toe is on the ground there. And if that's still too easy, you can do it on one leg instead. There's so many different ways you can load that tendon, whether you have some pain or you're wanting to prevent any injuries or just getting that area stronger. Okay. Okay, so I put on here just a couple things we do in the clinic to help just to examine, take a look at the foot and ankle. So we do have people do squats sometimes because it looks at hip strength, it looks at ankle mobility, it looks at your balance. Are you compensating on one side versus the other? Single leg stance, that's another good one we'll take a look at. And that's actually an exercise I do too. You know what? I'm going to show everybody that one as well. With this one, sometimes we'll have people stand on one leg.
So on chair, I keep doing that.
Sometimes I'll have people stand on one leg, just like that, and have them keep their balance. See if they can do that. I'm also looking at where their hips are moving, and then going downwards, how their ankles moving. Are they able to do this? Because let's say if you're walking or you're running.
Can you back up?
What? Oh,
Can you
yeah.
back up?
Let's you guys back there. Because let's say if you're walking or running. Part of the time you are walking or running, you are on one foot anyway. So you want to make sure you can support yourself in this position. Go ahead and try this out, guys. See if you can keep your balance doing this. If you do have an injury and you can't keep your balance, that could be part of the issue. And we do different balance exercises to really address this. All right. Okay, and then foot alignment and standing. So I'll be looking at somebody, how their foot's structured while they're standing. Are they caving inwards or outwards as they stand? Limited ankle mobility versus calf tightness. So if the joints of the ankle are pretty stiff, do we need to do some hands-on stuff for that? Calf tightness, for instance, some of those conditions like plantar fasciitis can be related to that. So do we need to do loosen up some tissues there? Big toe mobility. So is your big toe, how much motion do you have? Do we need to work on some stretches? Do we need to do some hands-on stuff to really get your toe to push yourself off the ground there? And then lastly, palpation. So a lot of that's just us figuring out where you're having the injury at, what tissues are affected. And then I did put on here too a couple cool exercises you can do. We have already gone over most of these. So toe yoga, yep, heel raises, single leg stance. And then lastly, I put glute strengthening exercises, because when you're on your feet for a while, whether you're walking, running, just anything on your feet, you want to have strong hips. That's helping to support those feet there. So a lot of times, even if I'm working with somebody who is having difficulty with their foot and their ankle, it may be stemming from their hips actually. So we'll work on that. I'm going to go over a little bit with you guys on landing mechanics with running as well. And Autumn's going to be talking with you guys further on Form 2 today. But just to kind of cover this, I did put a picture of somebody here who is overstriding. So what they are doing is they're putting their foot way in front of their body there. Because of that, they're getting a lot more impact on their foot, ankle, knee, hip. So ideally, you want to do a few things to get that area closer to your body. So what I do in the clinic and some of the other therapists in the clinic will do is teach you a couple cool techniques, tricks and tips to help get you so you're not doing that. So that might be part of the issue. Bouncing is when you're pretty much jumping up and down, putting a lot of impact on your feet as well. One thing I'll tell people to do with this is if you are somebody who bounces a lot when you run, you want to try to look at straight ahead, find an object, and make sure that object doesn't bounce up and down as you are moving. So it should be just straight in front of you the whole time. Put a few things on here too. Some things you need to work on with running is mobility, so being able to move well, stability, holding yourself pretty well as you're running, and then power and strength. A lot of what this is kind of like, it's kind of like cooking. So for instance, if you're cooking something, you have to have all the ingredients. So that's where these 4 things here come into play. But then you also need a recipe too, and that's your form. So it's how do you have all the components of that and how are you using them? And then lastly for you guys, if you are a runner, we do offer gait analyses in our company. That's with, just give us a call, let us know you're interested in a running gait analyses, and we can get that separately set up for you as well. What we do with this is we'll take a look at your form and see if there's some things we need to tweak for that, especially if you're having any sort of injury or you're wanting to prevent an injury. So just give us a call if that's something you're interested in. And then last but not least, some alternative treatments. So if, you know, a lot of what we want to do in the clinic is try to get things stronger, more loose, but if, you know, you're still having some difficulty with some things, there are orthotics and inserts available. You can go and buy these commercially, so like going to a store and buying them, or you can talk with your doctor about making one too. And then in the clinic, we do taping. I've shown my patients before, and I know some of the other therapists have as well too, different taping techniques to help you get through the day. And then foam rolling is another option too. That's just, you can go to a store and buy a foam roller to help loosen, work on certain things at home too. Okay, so any questions for me?
Yes, there are. Let me pull up the chat and a few questions here. Let me get to the questions. Okay. Do you recommend treating Morton's and Aroma the same as metatarsal?
It's a good question. It's an interesting question. Okay. Do you recommend treating Morton's and Aroma the same as metatarsalgia? Yeah, they pretty much are very hand in hand. A lot of exercises we do are very similar, but it depends, you know, not just on the presentation of your condition, but it's also like what's going on in your life too. So that would be something we'd have to like further talk about in the clinic as well and kind of take a look at things. So every person's a little bit different. So I could say maybe, maybe not, just depends on what's going on in your life there. Okay, next question. Do you recommend workout modification or abstinence for dealing with Achilles tendonitis? Do you recommend heel lifts? Really depends on the severity of it. If it's really impacting your day, getting through things, and I would say you may want to modify some stuff, or yeah, pretty much modify some things with that. It just depends on how severe it is. And do you recommend heel lifts? Again, same thing. If you can get through it without the heel lifts, then I would recommend that. But if it's something you need to get through the day, then in that case, I would recommend it though. Nothing else is working out. Okay. Is landing mechanics with walking important as well? Yes, it's a little bit different with walking versus running. You're obviously not putting as much impact if you're walking, but same thing, you want to keep your feet closer towards your body when you're walking. You don't want to be landing too heavily when you're walking. If you notice, like if you're walking and you're got like a really very much a bounce, then yeah, that's something you want to think about as well. So keeping your body closer to your feet closer to your body as you're walking. Do you offer walking gait analyses as well? So I usually do these actually with my patients when I'm doing an evaluation. A lot of times we'll just watch somebody walk during the evaluation in addition to looking at other things that needs to be addressed. Like if they're having foot and ankle pain, like, okay, that's a lot of what I do as part of my examination. So yeah, we do that. It is a separate thing from the running gait analyses, but yeah, if you just call in to say you want to have somebody take a look at your walking as well, yeah, we can definitely do that for you. Is there anything I can do to make my feet feel better? I have idiopathic peripheral neuropathy. So yeah, the foot checks, I saw on here, you came in a little bit late. So we are going to be giving out this presentation afterwards, so you'll have access to that. But like I said, doing some foot checks too. Foot intrinsic strengthening. So I did talk about toe yoga a little bit on this presentation. Any foot intrinsic strengthening exercises, I do show people those in the clinic. Other things to kind of work around that. So if certain things need to be stretched or loosened, do that as well. What about heat or icing for foot pain? This one really depends. So if it's, If it's a pretty recent injury, like within 4 to 6 weeks, I would recommend ice because it's probably pretty inflamed. You want to control that inflammation. Heat is good for loosening up tissue. So if something is tight, and again, we can take a look at that too and talk about that. Heat can be good to loosen that up. Both of them address pain, however. So if you're somebody who's had chronic ankle pain, you might be able to use both depending on which one feels better. So it just really depends on how long you've experienced it for. Do you have some tightness? What's the condition going on there? I have mild arthritis in my knee. Can I still run? Yeah, definitely. There actually was studies. There's actually been a study out there that I saw recently about how people of different ages have had arthritis and they've been asymptomatic and still able to go through their day, and they did have arthritis. And what I'm saying is just because you have it doesn't mean that's destiny. More of it's just how do you feel while you run? If it bothers you, then maybe there's some other things we can do to address that, whether it's your running form or some alternative treatments, or maybe just some strengthening. Maybe there's something that needs to get stronger too with addressing that. So there's so many different components to that to really address it. What are arch lifts? Do they help with the high arch? That is my problem. There are different types of inserts that are good for high arches and low arches. So all you have to do is, if that is something you're interested in, and they usually do sell them at sporting goods stores commercially, or you can have them made. That's a conversation with your physician though. If you need that, depends. You may not necessarily need an arch lift though. Yeah, so, and especially if you haven't tried strengthening or stretching certain things, you might want to try that out first. Do we need a doctor's referral to come for a consultation and or treatment? Okay. Yeah, so it just really depends on your insurance. Like I said, the consultation is free. All we're doing is just sitting down, talking to the physical therapist and seeing what we can do, if the physical therapy is a good fit for you and what we can do to help you. For the treatment, because that would be really very much an examination. I have to like full on take a look at you. Just depends on your insurance. Some insurances no, some yes. Give us a call. Our front desk can take a look at that and answer that question for you. All right, arch lifts. It's basically it's kind of like a type of orthotic or insert. So you just put that in your shoe and it just gives you a little extra support, whether you're wearing I think I've seen them before for high heels. Usually you see them for sneakers though. Sometimes when I sleep, I have restless legs and it interferes with sleep. What is the cause of that and what will help to alleviate it? There could be a lot of different things going on here. This is one of those things where you might be a good candidate for a consultation. So we'd have to discuss that a little bit further and take a look at it. Please. Okay. Are there foot exercises to help with knee pain? Yes, we have in the past done knee pain, actually a knee pain workshop, and we might be doing one of those in the future. We'll see how things go, so stay tuned on that. But yeah, you can do some of these foot exercises too for the knees. That may be part, because that may be the root of your issue, but they're also hip strengthening exercises can help with that too. But yeah, that's something good for something we can definitely talk about over a consult for sure. What causes foot cramping at night? Is there anything I can do to keep cramping from happening? A variety of different things. Sometimes those foot intrinsic muscles might be weak. Sometimes calf area or some area of the bottom of your foot might be tight. It might be dietary intake. That would be a question for your provider. It could be a variety of different things there. But biggest thing I'd say from our standpoint is something's maybe just needs to be stronger or just needs to be loosened up. So that was something we can take a look at further in the clinic. Arch lifts are not an exercise. Oh, okay, see what you're saying on this one. There is an exercise called an arch lift. There is an insert that's called an arch lift as well. All you're doing is you are trying to lift your arch upwards. So I just put that on there as a type of exercise. But like I said, there's so many different ones you can do for the foot and ankle. All right. You do teleconsultations. Depends on your insurance. I have done, a few of the PTs have done telehealth for patients. Yeah, it just depends on the insurance and it addresses this. Foot drop, a lot of that's gonna be, it depends on the severity of foot drop. A lot of that because of that, your foot's usually in this position as you're walking. So you want to work on strengthening muscles on the front here. So there's a few we do in the clinic. I am getting a couple questions on here too for what are arch lifts. So I'm just going to show that to you guys real quick as well for exercises. I'm going to show them real quick.
Oh, I did mix them.
So what you're doing. So an arch lift strengthening exercise, all you're doing is you're keeping your heel on the ground, toe on the ground, and you're just trying to lift that arch upwards. Now make sure your toe is on the ground. You're just pushing downwards to help lift the arch there. So it's a little tricky one too, kind of like the toe yoga. It does take some practice to do. That's something we work on in the clinic though as well. All right, I think that's all for questions.
There's one more, it looks like.
Was that the one that was just on there? What to do for sore ATFL, heat, ice. Like I said, if it's within 4 to 6 weeks, it's probably a little inflamed, so you want to put ice on it. Heat's good for loosening up certain tissues, so maybe above the calf, massage, that depends, exercise. There's different exercises you can do. We just have to take a look at it and see exactly where you're at with all that. But yeah, those things all can come into play. It just depends on your presentation. Is plantar fasciitis a permanent condition? It does not have to be. Now, I've actually had a lot of people who come in with plantar fasciitis and gotten a lot better. So no, not necessarily. And if not, and we also do we'll talk about some activity modifications too. Like what are some things going on in your life that we could help you move around a little bit better too. Okay. So on to James. All right. So, okay, I'm going to transfer this over to James. He's going to talk with you guys about footwear. Appreciate your all's questions and thank you for listening to me today.
All right, we're going to transfer this over to James at Performance Footwear. Let me give him access as the host. And